Even if we end up with better vaccines, and by the way, we keep forgetting how phenomenally fantastic the mRNA vaccines are. They could be developed in 10 months. Pretty amazing. From genome to human authorization. Pretty amazing. No other vaccines ever even come close. The fastest vaccine is about 4 or 5 times that speed. But they're very unlikely to prevent transmission. What they do, and what they're supposed to do, is mitigate the severe side effects of the virus. And that they do very effectively. There's enormous amounts of data, right? That they reduce hospitalization, they reduce more ICU admissions, and they reduce mortality. If you keep, and this I think was a fatal flaw of the Biden administration, if you keep emphasizing the way we're going to keep the virus down is by administering vaccine as if they prevent transmission, and then people say, I got the vaccine, but I got infected, you lose a lot of public trust. That is not a formula for good public trust. You need to be accurate about what vaccines can do. We, the advisors that are writing this, urged that on the administration many, many times, but vaccine was their only suggestion.